Welcome to Redbeard Radio. I'm Brian Keith, and I have bad news. The bad news, my friends, is that you are sacrificing your health for the sake of your business. Now, we're all doing it. And in some ways, it's obvious, like, did you work out yesterday like you meant to? But in some ways, it's not quite so obvious, like, maybe you shouldn't have eaten what you ate yesterday because you worked too late and you didn't make dinner. But there's some things we can do about it to stop sacrificing your health for the sake of your business. We have on here today an actual heart surgeon, Dr. Philip Ovadia, to help us understand how entrepreneurs are commonly harming their health by not taking great care of themselves and what they can do differently in their lives to have better metabolic health. Dr. Ovadia, welcome to the show.
Thank you, Brian. It's great to be here, and I'm excited to help your audience figure out how they can improve their productivity and their overall health.
Sounds wonderful. Now, your background, just so folks know here, you are an actual heart surgeon. You actually cut people open and solve life-threatening problems for people, right?
That is true, and I actually have a dual life as a physician. I help treat people's problems as a heart surgeon, and I also have a telemedicine practice that is focused on keeping people from needing my services as a heart surgeon.
I like prevention when it comes to my heart and not winding up in a hospital for heart issues. So tell me this, Philip, when you think about what entrepreneurs do that makes us more likely to go towards the treatment side of your practice and less likely to be in the prevention side of your practice, what are we doing?
Well, I think the number one thing that gets people on the treatment side of my practice is what they eat and how they eat. The other lifestyle issues certainly play into it, things like stress and getting adequate sleep and getting out in the sun and exercising. But the overwhelming cause of most of the problems that I end up treating on the heart surgery side of my practice are due to poor diet.
I was once working out a lot, and I noticed a buddy of mine who was extremely fit, an actual literal stuntman, and ran a stunt school, and he was really, really fit. And I was talking with him about working out because I wanted to have that chiseled physique. And Philip, he said cruel words to me. He said, "You can't outrun your fork." And I'd heard that since then. He may have been the first person to say it to me, or at least at the time that I was really open to that idea, that it actually didn't matter how much I worked out. Not relevant compared to what I was eating, and I couldn't just eat crap.
Yeah, I think that's been shown to be true in many different ways and by many different people. You can't outrun a bad diet. You can't outrun your fork. All different ways of saying that exercise is helpful and exercise has benefits, but ultimately exercise alone won't overcome a bad diet.
Now, as entrepreneurs, we have a million things demanding our attention. How do we know if we're in a place where our metabolic health, where our heart health is an issue to where we need to pay more attention to our diet? What are the signs?
Well, there can be some obvious signs, but a lot of times it's not obvious. And like many things in business, unless you start looking for problems within your organization, you're not going to find them. But some of the outward signs are certainly being obese, being overweight is strongly correlated with poor metabolic health. But importantly, you can not be obese and you can still be metabolically unhealthy.
Now, that's the scary thing because I think I'm fit enough. I'm not as fit as I'd like to be, but I'm plenty fit. I've climbed mountains. I'm fine. But what you're saying is that maybe I'm not because I haven't looked. I haven't looked at the numbers. I just feel pretty good. So I assume that I'm okay, but that's not what you found.
Correct. And, we have 5 official measurements that go into determining if someone is metabolically healthy. 2 of them are sort of external measurements, your waist circumference and your blood pressure. And the other 3 are lab tests or blood tests that you need to check in order to know if you're metabolically healthy.
What happens if I don't do that because I feel good? So why am I going to go to a doctor when I feel healthy? What if I don't get those 3 lab tests and I don't talk with someone like you about analyzing those numbers? What are the risks I'm looking at for a person who feels healthy and can still exercise and do all the things? What happens if I don't look at those 3 lab tests?
Well, when we look at the causes of chronic disease in the United States and worldwide, we see that most of these are related to poor metabolic health. And if you look for the metabolic health measures, those will start to be abnormal up to a decade before the diseases show up. Things like diabetes and high blood pressure and heart disease. Those become apparent at some point if you're not metabolically healthy. But if you look at your metabolic health parameters, you can actually figure these things out about 10 years prior, and then you can take actions to change the path you're on and hopefully prevent these diseases.
So I'm in my 30s now, and what you're saying is my not looking at the numbers now is opening myself up to problems in my 40s, maybe, because I'm choosing not to look. Is that right?
That's certainly correct. It's probably around the 40s and the 50s that these problems start to manifest themselves for most people. But again, it's likely that in the 30s and maybe even in your late 20s is when you first became metabolically unhealthy.
It's both exciting and a bit terrifying to think that I, who feel healthy and can work for hours out in the sun and I feel good, but to think that there might be something I don't know about that might have a big influence on my future. So, what do people do in order to get a handle on their metabolic health?
Well, as I said, the first step is figuring out if you're metabolically healthy. So find a physician, find a healthcare practitioner that's knowledgeable about this, that will work with you and will determine if you're metabolically healthy. And it's important to note that many times when we go for our annual physical exams, this won't be part of it necessarily. Some of it might be part of it. Things like your blood pressure are part of an exam, but some of the blood tests and some of the measurements are not part of an annual physical exam. And many doctors, quite frankly, don't look that deeply at metabolic health. So you need to find one that is knowledgeable about it and will work with you about it and determine if you're metabolically healthy. And then if you're not metabolically healthy, they can help you figure out what changes need to be made to get you metabolically healthy.
I'm a bit concerned about going to any random doctor because I look around just walking down the street at how many people are outwardly metabolically unhealthy by being obese. And I think they all have doctors. Everyone has a doctor. And yet, as a nation, you can look at the charts about how obese we've grown. And it's alarming. It should alarm everybody. And I think back to it wasn't that long ago that doctors recommended Camel cigarettes above other brands, that simply going to med school and even having decades of experience doesn't mean that a doctor is going to be able to really have good insight into metabolic health. So, what can a person do to verify that they're talking to the right people who have the what you perceive as the right understanding of the kinds of preventative actions?
Well, you could start by just asking your doctor, am I metabolically healthy? And if they kind of look at you and aren't quite sure how to answer that, then that might be a good indication that you might want to look for a different physician. Anyone is certainly welcome to go to my website, ovadiahearthealth.com. If you sign up for my newsletter there, one of the first things you'll receive is a free metabolic health assessment tool that can help you get an idea about whether or not you are metabolically healthy. And then I certainly have other resources there for dealing with your metabolic health if you're not metabolically healthy.
That's great. OvadiaHeartHealth.com, OVADIA, hearthealth.com. And folks, if you're on Twitter, Philip also is on Twitter at iFixHearts. One more question for you, Philip. When I think about time frame, you're telling me that what I'm doing or not doing now could have a significant impact on my heart health a decade from now. I think about that length of time and I think, how long does it take to change something? Like if I got these tests and I came to you in your telemedicine practice and we looked at some numbers and we said, oh, this number right here, that actually is indicative of poor metabolic health. How long does it take to actually move the needle and get me going in more the right direction?
These things can actually change pretty quickly. You might not undo all the damage or get them back to perfect right away, but we have data. Certainly, I routinely will check blood work on my patients about 90 days after starting a program, and we will see improvement pretty significantly. There have been other studies done where, as quickly as 30 days after making these changes, you can demonstrate improvements. So these are things that don't take long to start changing. Now, again, if you have 30 or 40 years of poor metabolic health to kind of undo, That's not going to happen overnight, and it's not going to happen in 90 days, but at least you start the process. And perhaps even more importantly, is by making these changes, you stop the damage that's being done on an ongoing basis, because this is cumulative. And the sooner you can stop more damage from being done, the better chance you have of it not becoming a major problem later in life.
This feels like the experience of a lot of entrepreneurs where occasionally you look at your credit card and you look at how many different subscriptions you have and how many apps you're not using anymore, or you were only using somewhat, but now you're at a different level. And just occasionally going and clearing out all your subscriptions to what you truly need, that stops the damage to your cash flow. And it can take a while for that to have an impact, but just that regular review of your numbers. It's pretty exciting that people can see a difference in their metabolic health in just a month or three. What are one or two things that people commonly do where they're seeing these results in 1 to 3 months?
Well, as I said, number one is certainly diet. And really, in the most simplistic form, it comes down to eat whole, real food.
What does that mean?
Well, I tell people that you should eat food that has one ingredient. It should be meat, or it should be vegetables, or something simple like that. Or it should be a combination of very simple ingredients.
But Phil, my Cheerios box says that it's heart healthy on the side.
Yes, unfortunately, your Cheerios box is lying to you, is the only way I can put it. And, I should qualify that. Your Cheerios box is a lot healthier than a bag of Oreos. But I still don't think that the Cheerios are the best way to achieve long-term health. And if you stick to whole, real food, minimally processed meats, vegetables, dairy products, things that came out of the ground or things that eat things that come out of the ground are really the only foods that are ideal for human consumption.
We have a phrase in my household: near food objects, otherwise known as NFOs. It's like UFO, but it's NFO. So it's cute and it's fun. And it's good to just look at any particular thing that you might buy, that you might put in your body. And you can say that's an NFO, like Oreos. And Oreos aren't really even an NFO. They're farther than that. But maybe chicken fried in seed oil, that's an NFO. You might really enjoy eating it. French fries fried in seed oil, that's an NFO. It's not exactly food. It's almost food. But some things have happened to where it's not going to nourish you. It's going to actually hurt you if you put that in your body. And we have a lot of data around that, right?
Yes, exactly. And, having a business audience, certainly they'll understand that the food industries are in the business of getting you to eat more food and to buy their food.
Mm-hmm.
They are not in the business of keeping you healthy. And they are a very efficient business. They know exactly how to create these, as you said, near food objects that will make you more hungry and make you eat more and therefore buy more of their product. I can't blame them from a business standpoint. They're doing exactly what businesses are supposed to do, but that's not serving your health. And that's something to keep in mind whenever you are consuming these processed food.
Let's say an entrepreneur has listened to all this and they're persuaded that they should clean up their diet. What's the one most important action they can take, specific action they can take to start on the path to eating less NFOs and eating more whole foods?
So again, I think if you eliminate anything that comes in a box or a bag, anything that has non-natural processed oils in it.
Just one thing. So the one thing is, if it comes in a box, don't eat it. Is that right?
That would be a good start.
If it comes in a box, don't eat it. I love it. Folks, to go get into the vast amount of depth that Dr. Ovadia can bring to your metabolic health, you're going to go to ovadiahearthealth.com, OVADIA hearthealth.com, on Twitter at iFixHearts. Philip, any closing words on how people can take care of their heart for the long term?
Well, I would just say, again, realize the importance of this. And speaking to business people, what would it be worth to you if you had 5 or 10 more years of more productive work? What does that translate to? And realize that how much your health is worth to you. Because if you're not healthy and you're not functioning optimally, that's going to translate into your business life as well. And it really is time for people to sit down and assess what their health is actually worth, and then invest the appropriate resources for something that's worth that much.
That's beautifully said, Philip. The ROI of your metabolic health is huge, And most of us are not tracking it near as carefully as we're tracking our asset portfolio or our business checking account or all kinds of other assets. Phil, thanks for being on the show, folks. OvadiaHeartHealth.com. I'll talk to you next time.